you need to seek medical care immediately. If you have symptoms of pneumonic plague,
Any other questions?
Normal, and they just follow me? Is that how this works?
Yeah, they're gonna follow you. Okay. So if you have questions, go ahead and ask them.
Like what you should have.
It should say Trump. Yes. Yeah, it will say Trump.
if somebody else breathes in the contaminated air, they will also develop a pneumonic plague infection.
So? Ma'am? Ma'am? Oh. Large. What's that? I guess, yeah, that's, I guess.
When you finish, I'll check your form. Okay. Do you have a middle initial? Email address?
No, I don't. I didn't know if I should put like a line through that or...
No, that's okay. We started. Thank you very much. Now just go through the yellow line here. Okay, just go right through here.
That was hilarious. This one girl calls up, like, I just gave it to me.
Hi.
Hi. All right, Abigail. Have you ever taken doxycycline before?
No, I haven't.
Okay. Are you currently taking any other medications?
I'm on birth control pills.
Okay. Have you taken antibiotics with your birth control pills before?
Yes.
Did they warn you to use extra caution in addition to the birth control pills? Extra
No.
protection? Okay. What happens with the antibiotics, they tend to decrease the effectiveness of the birth control pills, so it's always safe to use protection in addition to your birth control pills
Okay.
because you risk of getting pregnant.
Oh, okay.
Okay. Doxycycline, take with food. If you're going to be out in the sun, put a little bit of extra sunblock on because it does make you a little bit more sensitive to the sun. Do you drink alcohol at all?
Just on occasion.
On occasion. Okay. Avoid alcohol when you're on the antibiotic because once again it'll decrease the effectiveness of the antibiotic.
Okay.
Any history of liver problems or anything in the family that you're aware of? Hepatitis or...
My dad had hepatitis C.
Okay. Have you been diagnosed with hepatitis C at all?
No, I haven't.
Okay. And then you're going to pick up for your family?
Yeah,
All right. Anybody in your family have any liver problems that you're aware of?
No.
All right, you need to go. Everybody, going to get a liquid for 2 pounds. So you need to go to family dispensing because you're going to get liquid. Okay.
And
you
then
pick that,
I can just pick it all up there?
Pick it all up there.
This one or that, like the first one?
Either one, either line.
Okay.
Whichever's available.
All right, thank you.
Okay, thank you.
Very well, how are you?
Okay.
You're picking up medication for all these folks?
Right.
Very good.
All of us.
You allergic to anything in your Abigail?
I'm Abigail.
You
Dad.
allergic to anything, Abigail?
No, I'm
Let me
not.
ask you some questions about your other folks. Art is 37. Is he allergic to anything?
No, he's not.
How about, is it Arturo?
Right.
And he is 12. Can he swallow medication?
Kind of has a hard
Probably
time
not.
with pills.
Okay,
yeah.
so what I'm going to do, we're going to do 2 steps here. I'm going to give you and Art medications here. You're then going to go around the table and Carol will take care of the kids, and she's going to make the specific pediatric stuff. Neither of you allergic to anything?
No,
so
we're
we'll,
not.
We'll be giving you doxycycline, okay?
You know, actually, I don't want any doxycycline. I'm not going to take any today.
Why?
I don't want to take it here. I would rather take it at home.
Well, I will prescribe it to you. Have it give you the prescription now. You can go to the First Dose folks and talk to them. And if you want to take it at home, you'll have the prescription with you at that point, okay?
Okay, because yeah, I don't want to take it here.
You're not having any symptoms of anything at this point?
No.
Okay, very good. Now, the way we're going to do this, there are a couple different tags. I'm going to put a tag on this sheet and give it to you. I'm going to put another tag on here.
And this is the one that's for my husband and I?
Well, I'll give one for each of you. So your name will be on one and his name will be on another. Okay? Shouldn't have cut my fingernails.
How long is this dose to be completed?
It's a 7-day dose,
Okay.
and you're to continue it till the end of the prescription. Okay? Like any other antibiotic, you really don't want to stop just when you're starting to feel better.
Okay. And how many times a day?
I believe it's 2. 2 doses, one 12 hours apart.
Really? There's not enough room on here, so we'll put this here. And we get the real.
Okay,
This
Abigail,
isn't going to make any side effects or anything?
that one's specifically for you.
Okay. Yes.
What I can do is this will have information related to when you should take it, how you should take it, etc.
Okay.
If you have any specific questions, I can refer you directly to our pharmacist who's with us, and he's going to be able to answer it a lot easier than I. So that might be the better course of action right now. That's and if you notice, that prescription number matches on the bottle, so you'll know which is your bottle and which is Art's bottle. Okay? And once again, then I'm going to send you over to Carol for the 2 kids. Okay? Here's Art's. That's yours. You need to keep your card with you.
Stopper in the bottle. Invert the bottle, and then you draw down to the line. And the instructions are on here.
I'm picking up prescriptions for my kids.
Pardon me?
Picking up prescriptions for my kids.
Okay. We got a 90-pound trial. We got Arturo. So.
And so you would be next after this young lady with the camera.
Brad, I have an adult syrup, 126. So I need a 6-ounce bottle. Okay.
So how long should we be taking this for?
7 days.
And do you give it to him like once daily or?
No, he's going to be
Twice
given
a day.
twice a day,
Okay.
12 hours apart.
Okay.
Okay? And we're going to give you each individual bags
Oh, good. Okay, good.
for each child.
Like you're having a tough day. You just the way you were just walking down, you're like, oh, how are you today?
We'll give you enough to get through 7 days.
Are there any side effects that I should watch out for?
Yes, if there's, notice if the child is even having any rash,
Okay.
if he's getting short of breath, having problems breathing, if they're, getting a little cyanotic,
Okay.
then you need to get to the, call 911, go to the emergency room, whatever you have to do.
What does cyanotic mean?
When they're starting to turn blue, you'll notice their fingertips or their lips are turning blue.
Oh,
Means they're having
okay.
problems breathing, if they're trying to catch their breath and they can't.
Okay. Thanks.
Okay. This is Arturo. And Arturo's going to take. Sorry. 9 mLs. And the lot number is 3A02.
Okay, I'm going to show you how to give the medicine for Arturo. Take your little stopper, place it inside the bottle. Okay? As far as it can go so it doesn't slip out and you lose any medication.
Okay. So there's no needles or anything?
Right.
Oh,
You're going to take your little dropper here. This is Arturo's dropper. It says right on here you're going to take 9 milliliters. So what we're going to do is bring the air out so you can put it on the top. Push the air in, it'll be easier to get the medication out. And draw it up.
Oh, well. This is my kind of job.
What's next
So
to
you
tomorrow?
get full enjoyment.
No. If you push it in far enough,
long
it
as I can
won't.
sit here and talk,
Go
it
right
won't.
to the mark.
Okay.
Using the form. Would you like some
Well,
drugs? No.
it may splash a little bit, and then give it to the child. Okay?
I shouldn't be so quick to say that, should I?
I know.
Do I have to wash that piece, like when I'm done?
Yeah.
Water.
Okay.
Yeah, just plain water.
Oh, okay.
77.
Here we're going to give you 2, okay?
Not a problem, Mark. On my way.
Well, you have to say.
How you doing? Good.
This is just the sheet for Arturo. Okay, this is for Arturo. Can you put your bottle in there?
All right, man. How are you today? Just for yourself?
Yep.
You're supposed to be there.
Oh, he told me here.
But you know what I'm going to do for you, Kelly? I'm going to go ahead and begin the process.
Okay.
You allergic to any medication? Nope. Take any medication daily to cure your problem? You take a doxycycline?
Do you have Arturo's medication sheet? The little pink one?
No, I don't.
Okay.
Generally allowed. You start in front of this blue sheet.
Okay.
What I need you to do is make
Can I have one of these bags so I can put these medications
Well, I'm going to give you a bag.
Oh, good. Okay.
I'm going to match
Just too many things all at once.
Go ahead and
Okay, so now how much am I giving Amy?
take the first dose before you leave us.
5.5. So we'll give you Amy syringes. We'll put them in separate bags.
Okay. Same principle.
Same principle.
Twice a day, look for the same reaction. Especially in a smaller child, you know, she may not be able to tell you that she can't breathe, but just
Okay.
look for, if you notice that she's having problems, she can't speak to you, you notice that there's a rash developing, you need to get emergency attention right away,
But the
okay?
most common side effects are minor. Minor, like stomach upset, things like that. There's a chance of rash, but again, that's a lower. It's most common is GI upset, and if they can't tolerate it, there's a bunch of other different antibiotics. So you call the doctor, and we switch them to a different drug. The worst thing to do is stop them altogether. This is for Amy, so get them. Okay, go ahead.
Okay, for Amy. Amy is going to get 7 milliliters. Okay, so fill it up the same way, we'll give you the white stopper for her. Yeah, that's pretty good. Fill it right up to the mark. Just repeat it the same way. All right?
Medication daily to cause a problem. There we go.
Do I need to take anything
What I'm
else?
going to do is 2 things.
We need RX numbers,
For
right?
yourself, Elaine,
Okay.
Wayne, have any problem taking your medication?
No.
Ready? The allergic
Arturo
to
16.
taking any medication daily to cause a problem with you.
Let me mark it. I'm sorry, I didn't mark it.
Been recording project.
May I have Arturo's bottle? May I have the bottle, please? Yeah. Didn't mark the bottle. RX number.
Blue sheet is your instructions.
16. Here, if you could. Here. Amy is 7. And let me see Amy's bottle. She's 17. And that should do it.
There's a drug number above. See that number? Yeah. That number will correspond to one of those little numbers on there. Okay. So that you know which is your bottle, which is Lane's. Okay. And what we're going to do is I'm going to send you over to Carol. Okay. Carol's going to get you the
You know, I was gonna ask you if my kids start to get like a fever from this, should I give them like any Advil or Tylenol?
You could give an antipyretic, but just because of what's going on with this disease, it'd be really prudent to call a doctor too right away, because that's one of the symptoms of the disease as
Stop
well.
over and see Carol.
Great, thank you.
Thank you.
Where should I?
You can go down to get your first dose, your dose at this table here.
Oh, okay.
They'll give you your first pill. Hi.
Hi.
How are you? Okay, good. You ready?
Actually, I'm not taking medication. I don't.
Oh, you're not going to take medication?
No,
Okay.
I don't want any.
What you need to do then is go over there and stamp your card and just put your white card in that box right over there.
Okay.
Okay?
All right.
You got the medication for your
Yeah,
family
I got
right
my
there?
family's,
Okay,
yeah.
you're all set then.
Not
All
really
right.
interested. All right,
Good
thank
enough.
you.
Thank you. Yep, that's it. Thank you.
You need help? Yes, okay, so you don't need allergic to any medicine? Give them allergic to any general? No.
Are we going to be able to get a hold of you at this phone number if we need to get a hold?
Excuse me.
Are you in the middle of something?
Yeah. Have him wait 1 second. I'm having a hard time breathing. He told me that I'm having a hard time breathing.
You're having a hard time breathing?
Yes.
Okay, we need to get him.
What do you think? What should I do?
We need to get him to the medical facility and have him triaged to the front of the line right away.
All righty, thank you.
That person here.
Okay, and do we have an interpreter?
I'm the interpreter.
Okay. Okay, sir, let me see.
I'm having a hard time breathing.
Okay, so he needs to go to medical. We need to send him over to medical for an evaluation. Ask him when the symptoms began.
Just like 2 days ago, maybe 2 days ago, but really, it's really bad now.
And was he at the Blackhawks game or Union Station?
Yes,
Was that the Blackhawks game? Okay, let me get a mask for him, and we're going to take him over and have him evaluated medically and probably transported to the hospital. Would you put your mask on, sir? Okay. Let's pull this down under your chin, clamp it over your nose, and then I'm going to have the interpreter take you over for a medical evaluation, okay? All righty. Just go with him, sir. Get a transport. Tell them you're going to bring a transporter over to take you folks to medical evaluation in just a minute. Are you short of breath? Ask him if he's short of breath.
Yes, I'm very having a hard time breathing.
Okay. All right. Where I'm going to take you. Then come with me. You have a wheelchair.
make him so. Oh, you're done. You're all done. I need a transporter and a wheelchair to take this man. He needs a medical evaluation right away. So do we have a way to get that? Yes. Okay, so are you taking him or am I taking him? I need to...
I need interpreter.
Yes, you're the interpreter.
Yeah, that's what
Okay, what do you want me to do?
Do we have a wheelchair?
You know.
He's pretty short of breath.
You know, what's happening?
Okay, tell him we're going to take him for a medical evaluation and probably transport him to the hospital.
That's fine. That's fine.
Okay.
Will I be fine? Will I be fine?
Yes, we'll take care of him.
Get a wheelchair. Okay, getting a wheelchair. I guess I don't.
I feel very, very dizzy.
Okay.
I feel very dizzy.
Sit down. Sit down. Put your head down. Doesn't make me cough.
You want a chair or you want to sit on the floor? You want a chair?
Well, he was dizzy. I didn't want him to fall.
Some help for you, okay? Calm down, we'll be fine.
It's where the nurse gets sick.
I get it.
What about the interpreter?
I had the cough before I came, and it's just been talking so much. My throat's getting irritated. Is he really dizzy, or is this just the part he's playing?
Play.
Okay, just wanted to make sure, because sometimes having that mask on can make people get really dizzy and have trouble breathing.
I think you can throw up.
Okay, let's... We would use this. You take your mask off if you were going to throw up so you wouldn't aspirate. Got it around your glasses. Oh, good sound effects. Sure. Do we know how long it's going to be till we look? If he was really this.
Oh, I know. We're getting much right.
Yeah. Okay. Sir, would you ask him to stand up? We're going to move him over here so we can bring the next group in. Here's a wheelchair.
chills?
Yes.
Okay. Okay. Well, we'll just have him. We're gonna bring him right around. Bring him right down this way. 19. I can believe that age. Just right back down.
How's all this?
Ma'am, hey.
Right here.
0.5.
Not you again. Hi, I'm Dr. Marita. How are you? What's going on?
I'm very, very, I just threw up. I have a headache. I'm dizzy. I can't breathe.
How long have you been sick?
Last Saturday.
Since last Saturday. And have you had fevers too?
Yes, very, very hot right now.
Okay. Have you been at United Center, Union Station, O'Hare Airport?
I went to the Blackhawks game.
And since then you've been sick. Are you coughing anything up?
I've been throwing up.
How about coughing?
I have a little bit of blood in my mask.
Based on what based on what you're telling me, we're going to need to send you to the hospital for further evaluation.
That'll be fine. What's happening to me?
I'm concerned that you might have something called pneumonic plague. It's an infection of your lungs and it can make you very sick. If we get you to the hospital right away, we can get you started on medications. And you should do fine. Your body will respond better.
That's fine.
Okay. I'm going to need your card actually to fill out some information. Are you on any medications? Do you have any other medical problems?
No. I'm very, very, very busy.
Okay. What's your name? Your last name?
Last night,
Oh, sorry.
I started getting hot flashes.
L-A-M.
I got
Lane.
hot all over.
L-A-M-G-E.
And I started getting